I don't know about you, but for me, going to the dentist is one of my least favorite things. It's not because I have a bad dentist, just the contrary. He's great. I just don't like the feeling of someone digging around in my mouth. Well, Dr. Dan Davidian is here with his patient Simon Barnes to tell us about sedation dentistry. Simon, you avoided going to the dentist for years, didn't you?
Oh, yeah, scared to death of them.
Why?
I guess bad childhood experiences. Dentistry's come a long way. Just the way it was when I was a child and the thing I went through in the dentist, I just scared to death of them. So I went about 15 years and just didn't go.
Wow, so you finally went and you chose a doctor who does sedation dentistry, right?
Yes, I did.
What difference did that make for you?
All the difference in the world. You know, I was scared about what they were going to say when I went, what it was going to look like, what they were going to chastise me for, and judge me. And I got there and there was none of that. They just understood everything, told me what their plan would be. It was great.
And Dr. Davidian, you really pride yourself on not chastising and judging your patients, right?
Absolutely, absolutely. A lot of patients that haven't been in 10 or 15 years, there's a lot of dentistry and they know they've got things going on and they're worried the dentist is going to, tell them how bad person they are and things like that. And, at Sedation Dental Care, we just, we're there to hear the stories and to help the patient get over their fear and to do whatever we can to make them comfortable. And many times it is sedation that allows them to get over that fear.
Tell me about the process, Simon. What's it like when you get in and you go through the whole process of sedation and coming out of it?
Best sleep I've ever had.
Sounds good to me.
I go in, I sit in the chair, I take a couple little pills. I wake up, I'm at home. Can't tell you a thing that happened. So I don't know what it was like. All I know is I went to sleep. I woke up, I was at the house, and everything had been done.
Yeah.
And I have no memory of it at all.
Okay, so Dr. Davidian, you tell me what it's like. Simon doesn't know.
I think that's a good way to put it. Basically, we do. We'll medically evaluate the patient. We'll evaluate the level of sedation they need. We'll give them some pills to relax them. There is no memory of the appointment. Patients are at a level where we can wake them up and have them respond to us, so they're not unresponsive or necessarily asleep, but they're at a level where they are comfortable and relaxed and they get their dentistry done and they don't remember a thing.
Now, is this good for anybody, or are there certain people who are cut out for this and some who aren't?
Dentistry-wise or patient-wise?
Patient-wise.
Patient-wise. Everybody is a candidate as long as your health is appropriate. It's pretty natural for most people to have a fear of the dentistry, of dentists. So a lot of patients just utilize it because they just have anxiety that they need to get over. Some people have true phobias. The varying degrees of what kind of patient, and some people just have time management. They have a lot of things they need to get done. They can't take off 3 or 4 days off of work. They just need to get it done in one trip, so they come just because they have a lot of dentistry that needs to be done. But it's kind of like if you went in for nose surgery or eye surgery, and you're going to get sedated for that. Yeah. And so it's not necessarily out of the box to think, why wouldn't you get sedated for dental surgery?
Yeah. So I bet you'll never do it any other way. Huh.
Well, to tell you the truth, that first visit that I went, I had, I want to say, 2 or 3 root canals. I had a tooth pulled. I had a periodontal where they scraped down to the root. I had a cleaning. I had about 8 or 9 fillings.
Good.
That was all in one visit. They told me I did great. Like I said, I had no memory of it, and that was the best way to do it. And that's been about 12, 13 years ago, and I've slowly, the way they've worked with me and the way they are, I have gained their confidence now to where I've gone from having to take a Valium just to have my teeth cleaned. And taking an extra shirt because the other one would be soaking wet, to where now I can go in and have my teeth cleaned. And last week I actually had a filling in a crown and wasn't sedated at all.
That's impressive.
If you're scared of heights, it's like jumping out of an airplane going skydiving.
Yeah.
The way I feel, I've progressed that way. And I mean, I have only them to thank for it,
You've evolved as a patient.
Yeah, so it's a long way, believe me.
Wow, that is a fascinating story. Thank you for sharing it.
You're welcome.
And thank you for your expertise.
Thank you.
More information about sedation dentistry on our website, mycarolinatoday.com. We'll be right back after the break.